I remember when the AIDS first came out, and it was somewhat similar, but nothing like this, and the way that people have pulled together and the dangers that they face and the unknown. It's just, I have such respect for the people I work with.
Hartford healthcare workers continue to go the extra mile. The man helping lead that charge, CEO and President of Hartford Healthcare, Jeff Flaks, our pal. Jeff, thanks for joining us today.
Thank you, Tom.
We're going to bring in our friend Chris Murphy to ask you a couple of questions later. But hey, innovation in these times of crisis is important. A lot of innovation happened in World War II. How is Hartford Hospital innovating to kind of meet the challenges, especially as it relates to telemedicine?
I'll tell you, it's been remarkably rewarding and truly essential to see the importance of innovation. It's happening at the federal level, at the state level, and at the local level. Just if you look in our own community, OK Industries in New Britain has set up an assembly line and is building face masks now and face shields for healthcare workers in our state. In Newtown, Curtis Packaging similarly has built face shields. One of our medical residents is using 3D printing and is actually creating N95 equivalent face masks for our staff. So there's so many examples of innovation and new approaches being taken today to help support all the people working at the front lines of healthcare, help keep people be safe and properly looked after during this time.
Hey, Jeff, we have a familiar face, not on set with us, but certainly by Skype. One of your biggest supporters down there in Washington, D.C., our friend, Senator Chris Murphy. Chris, why don't you have at it?
Yeah, thanks, Tom. Jeff, thanks for being such a great counsel during this time. Jeff and I were on the phone at the very early stages of this crisis, and he was amongst the first to raise for me the dire state of personal protective equipment. And he's right. We are very grateful to all the Connecticut manufacturers that have stepped up. But Jeff, we were talking on the earlier segment about my belief that we need to empower the federal government to make more sense of a supply chain that forces you to bid against thousands of other hospitals, against other states, against the federal government itself. The feeling really is that there's chaos out there in the supply chain today, and without a firmer government hand, it's going to be difficult to keep the PPE and the tests ramping up. So I just sort of love to get your perspective on where the supply chain is from your perspective and what the federal government can do to make more sense of it.
Absolutely. First, let me thank Senator Chris Murphy. He's a tremendous advocate for healthcare and for our state, and the senator has a particularly strong passion around healthcare policy. So we're always very closely engaged and has been very helpful to us, particularly in behavioral health historically in many areas across healthcare. The issue you're describing, Senator, around what's being done around personal protective equipment across the country, this needs reform, and it will be done differently in the future, I'm certain. But real time, what we're doing on the ground is we've set up a 24-hour, 7-day-a-week supply chain operation because this is a global process. So we have people in our organization who are working across different time zones, real time, to ensure that we can do everything humanly possible to ensure we bring as much personal protective equipment here to Connecticut and to our organization to protect the people, the heroes working on the front line. But I also will note the state of Connecticut is our partner in this way. We're working hand in glove with the state. They too have expended tens of millions of dollars to address the criticality of this moment. Longer term, we need reform. We need things to be done differently. If you look at the National Oil Reserve, I'm fairly confident that we're going to have a very strong national reserve in place, as well as at a state level. And certainly organizations like mine are going to build up very significant supplies. We were fortunate. We had a very significant supply at the front end of this, but given the unprecedented dynamics we're dealing with, I'm certain we'll double to triple the size of our inventory as we go forward.
Listen, my perspective on this is that I just wish that we had you full-time engaged in the business of providing healthcare instead of having to devote so much energy to sourcing the material that you need. This is something I think that the federal government should take off your hands and off the hands of states. Tom, if I could ask just one more question, I'd just love for you to say a word, Jeff, about your workforce. It's just been incredible to see what your frontline healthcare workers have done, how willing they've been to put themselves out in front of an epidemic that would be worse if not for them. We're talking about ways that we can support them in Congress. There's a lot of interest in perhaps providing some additional pay or some additional benefits to those who have been out there for weeks and months, but you've just got to I imagine, be in awe of what your workforce has done during this time.
Oh, I am in awe. It's really beyond description what people are doing on the front lines today in healthcare. The resiliency that people are showing, the bravery, the courage, the expertise, in the way that they're really jumping in and going into the crisis is amazing. We held an event this week where the police and fire on our campus in Hartford came to pay tribute to our staff, and to see all of our colleagues come out and be recognized by all first responders. The esprit de corps was absolutely amazing. But what I really remarked on in talking and having a chance to see so many people was their absolute commitment. They're here for us at our times of greatest vulnerability, and it's never more apparent than in this moment. But I also would remark, Senator, we as an organization are doing everything we can to support our staff. I mean, the very clear things around personal protective equipment, temperature checking everyone who enters in our building, changing policies around limiting or eliminating visitation, but really so much more. We've stood up and are in the process of putting together a 24-hour, 7-day-a-week colleague support center that's focused on daycare, that's focused on hotel rooms, access to food and other basic services, as well as behavioral health support. So there's so many ways that we can support our team that is critical during this time period, because they are the heroes, and we depend on them now more than ever.
Attaboy, Jeff. Hartford Healthcare CEO and President Jeff Flaks. Not the last time that you're going to be on Cap Report. Chris, say goodbye.
See you. Thanks, Jeff, for everything. Pass our thanks along to your whole team.
Up next on Cap Report, if there was ever a time for the state to have a Renee Day Fund, this is it. We'll discuss the state's fiscal footing with our pal and Murphy's pal, State Treasurer Sean Wood, when we get back. Don't go away.